The urinary system includes the kidneys, ureters, bladder, and urethra. It has many functions, including filtering the blood and eliminating wastes, regulating blood and urine pH levels, and working in collaboration with the cardiovascular system to regulate blood pressure. The urinary system also provides reproductive functions in the prostate for males. The kidneys also release a hormone that stimulates red blood cell production and synthesizes vitamin D to assist in bone health. Each of these functions is vital to well-being and survival. See the illustration above of the structures of the urinary system. Blood is filtered through the kidneys, and the filtrate is transformed into urine at a relatively constant rate throughout the day. The urine travels from the kidneys through the ureters to the bladder. The bladder stores urine and signals the brain when full, around 300 ml. It stores urine until a convenient time for elimination or voiding, and then the brain allows the urethra to release the urine. Urine is a fluid of variable composition. Urine characteristics change depending on influences such as water intake, exercise, environmental temperature, nutrient intake, and other factors. Characteristics such as color and odor provide a rough estimate of a person's state of hydration. For example, after exercising or working outside on a hot day and sweating heavily, urine will become darker with a slight odor. See the image above for ranges of urinary color related to hydration status. Urine volume varies considerably. The normal range of urine output for an adult is 1 to 2 liters per day. The kidneys must produce a minimum urine volume of about 500 ml a day to adequately eliminate wastes from the body. Output below this level can be caused by severe dehydration or kidney disease.